So I've had the opportunity at this year's San Antonio Breast Cancer meeting to speak about cardio-oncology, which is actually the first time this has been presented at San Antonio. I'm going to talk a little bit about the impact of breast cancer drugs on cardiovascular health. We've long known that anthracyclines and trastuzumab, an anti-HER2 agent, can cause cardiotoxicity, most often expressed as a drop in LVEF or heart failure. But there are many new drugs out there now in the treatment of breast cancer. So I'm going to go through some of those newer drugs, such as CDK4/6 inhibitors, immune checkpoint inhibitors, which are really big now in triple-negative breast cancer, and the impact of those particular drugs on cardiovascular health. I think any time that you're treating a patient with cancer, breast cancer in this case, with a drug, we need to be aware not only of the normal side effects that are associated with, that we often see, whether that be nausea or vomiting, but almost all of the newer cancer drugs now coming into clinical practice have some form of cardiovascular toxicity. For instance, ribociclib is a CDK4/6 inhibitor. It causes QTc prolongation, or it can. So we have to be aware of that, and they recommended that we do ECGs in this patient. Immune checkpoint inhibitors, in this case pembrolizumab, is used in triple-negative breast cancer in the metastatic setting and for women neoadjuvantly. But it can be associated with myocarditis and other forms of cardiovascular disease, which can be very serious and cause significant morbidity and sometimes mortality. So it's more than just sort of the traditional, we are used to treating with chemotherapy drugs, but these targeted therapies now have unique toxicities, including cardiovascular toxicity. So it's really increasing your understanding and awareness of what these toxicities are for these different classes of drugs.